Hello everybody, my name is Dr. Archana. I'm one of the senior obstetricians and gynecologists working with Motherhood hospitals in Banashankari as well as their outreach clinic in Kanakpura. Today I have the privilege of sharing a few words on antenatal care in pregnancy. Why exactly do we do it? What all is done? And at what point of time in pregnancy do you have to get all these tests done is what I'm going to discuss about. So as we all are aware, pregnancy is a very joyful journey for not only the mom, for the entire family. So to keep it that way, there are a few things which definitely all moms will have to undergo and do to see to it that they are safe, the pregnancy is safe, and of course the little one is safe. So as soon as the pregnancy is confirmed, that is once a woman misses her period, generally most of us are able to avail the urine pregnancy kits which are available over the counter and confirm that yes, the pregnancy test is positive. So if you're planning a pregnancy and then you get to know that you're pregnant, I'm sure you would have already been started on folic acid supplements, which you need to continue because this is what we give in the first 3 months of pregnancy as well. So your first visit would be expected until and unless it's a high risk situation. It would be expected to happen around 6 to 8 weeks, wherein we actually confirm the pregnancy by doing a scan, seeing the baby and the baby's heartbeat. This will help us to confirm that yes, pregnancy is there. We are looking at the number of pregnancies, whether it's a singleton pregnancy or a twin pregnancy. If everything else is okay in terms of the adnexa, the ovaries, the tubes, there's no other associated pathologies, this is what we look at in the first scan. Of course, most importantly, this will help us understand whether the date of delivery coincides with your period date itself. Now, after this, we would do your routine blood tests. For example, we check your hemoglobin, sugars, thyroid. We do a serology screening, a urine routine test. These are the basic tests which we do to see to it that you're healthy and we can embark on this journey without any trouble. Now, the next scan would be around your third month, that is between 12 to 14 weeks, preferably around 13 weeks is what we do, called as the NT scan, wherein we measure the thickness of the back of the neck for the baby. Any nervous system developmental issues, brain development, developmental problems with the spinal cord, all these things can be assessed in this scan. Apart from that, this specific value, the NT value, is taken into consideration when we do an additional blood test, what we call as a double marker. This is to understand if the baby is at any risk of developing genetic problems. You might have heard about Down syndrome. So this is one of the screening tests for this. Apart from that, which is trisomy 21, we also check on the 13th chromosome and 18th chromosome. Please bear in mind, these are all screening tests. They are not confirmatory tests. If you come screen positive, it means that you may need further tests to confirm whether the actual baby is suffering from that genetic problem or not. Now, after this, next scan would be around your 20 weeks, what we call as the anomaly scan. This is the most important scan for a woman because by 20 weeks, we expect all the vital organs, the internal structures for the baby to have formed. So, we do a detailed survey from head to toe to make sure that the baby is fine and we can continue the pregnancy. At this point of time, you would also receive your tetanus shot, the first dose, and we then call you around 24 weeks to make sure that you're not diabetic, because as Indians, as Asians, we are all extremely prone for developing diabetes in pregnancy. So this is a blood test which is done around 24 weeks because that is the period of pregnancy wherein you're at highest risk of developing diabetes. So that's the idea of doing the diabetes screening test at around 24 weeks. Now, after 24 weeks, your next test would be around 28 weeks, wherein we would do a growth scan, that is the 7th month scan, just to make sure that the growth of the baby is good, the fluid around the baby is good, and we are rest assured that we are on the right track. Now after this, your last scan would be around 37 weeks. Now let's say we have picked up a high risk factor. For example, your sugars have been a little bit here and there. We may want to repeat your sugar test in your last trimester along with your hemoglobin, just to make sure that we are looking at the right numbers and we are well prepared for your delivery at 37 weeks. Now the last scan which we do is around 37 weeks of pregnancy. This is basically to understand the position of the baby. We want to make sure that the fluid around the baby is good. We want to understand what is the approximate weight of the baby, because all these things will help us understand the plan for how we allow you to delivery. For example, let's say unfortunately or fortunately the baby has the bump down, what we call as the breech presentation, then unfortunately we cannot allow for a normal delivery, especially in first time mothers. So breech is an indication for a cesarean delivery, which we would do around 37 to 38 weeks. Now let's say the fluid around the baby is absolutely normal, then there's no harm in waiting till your 40th week for you to go into labor spontaneously. So these are a few things which the last scan will help us understand. Now the second dose of tetanus injection, sorry I forgot to mention, would be given generally around 28 weeks of pregnancy. So these are the normal tests which we do through the course of pregnancy. Apart from this, you would have your regular visits, generally once a month visit with your obstetrician, with your doctor, till you're reaching your 7th month. In 7th and 8th month, it would be once in 15 days, and in your 9th month, it would be weekly once till you deliver. If the need arises, your doctor will guide you in terms of recurrent or revisits depending on the clinical situation, and it's very subjective. Now apart from this, there are few other things which we have to bear in mind. Obviously the diet and nutrition aspects as well. I'm sure your doctor will help you understand the do's and don'ts, the pattern of exercise which you need to do, and what should be your fluid intake. Is there any specific positions which you need to take during your sleep? But all these things, as your doctor will discuss as the pregnancy moves ahead. Now apart from this, there are special situations. For example, let's say the mom is having a negative blood group and the father or the husband happens to have a positive blood group. In such situations, we do special tests, one at 12 weeks and the other one around 24 weeks of pregnancy, and we also tend to administer special injections, what we call as the anti-D, at around 28 weeks and 34 weeks of pregnancy. So pregnancy, as far as I believe, is an absolutely physiological, normal process. So we do not want to medicalize pregnancy as much as possible. I personally believe if any woman is pregnant, we leave her in any forest, she should continue with the pregnancy, deliver and come out with the baby in her hands. That is how a woman is meant to be, that is how her body is, that is how she is psychologically as well. So please bear this in mind. Pregnancy is not a disease and we want to keep it as simple as possible. Nowadays we have a lot of access to so much information, but please bear in mind, not everything is true. So if you want 100% confirmation, your doctor would be the right person to go. So please bear this in mind and have a happy, healthy and a safe motherhood. Good luck everyone.